Good evening, friends. Today again we are meeting with the consecutively third session of the Silicea because it's a big remedy, a polycrest having a multi-dimensional aspects. It's a remedy we have to learn by heart. We have learned the first on the day one. We have learned from Allen's the constitution, how the persons are, how the childrens are, what is their constitution? The scrofulous children with large head, open fontanelles, looks like to be calcarea, but different than calcarea. A chilly constitution, very chilly in fact. Rachitic children. There is losing flesh while eating well. The assimilation is the basic problem. All those things, the constitution which we have discussed on day one, along with the different cases of the Silicea. Yesterday we have learned the how the patient presents to us, what the patient, which what symptoms the patient is brought to us, the causative factors, the causative modalities, that is the suppressed foot sweat, that is the first important thing which we have discussed in yesterday's lecture. Then the exposing the head or back to the draft of air, that is very important thing. Then bad effects of vaccination, that's what another causative factor which we have discussed. The chest complaints of the stone cutters. So causative factors, then the headache, the very specific headache, the very specific vertigo, which is there, the migraine headache associated with vertigo. Vertigo starts from occiput, it goes over vertex, and then it is followed by headache, and the headache settles either in one of the eye, more commonly with the right. All those aspects we have discussed, and this happens quite commonly with generally in new moon or full moon phases. So many aspects of the remedy which we have discussed in last two lectures. Today we have to go ahead and finish from Allen's keynotes the aspect of Silicea. So we'll start with the next part. There are many questions over there. If time permits, we'll discuss them today, or if it is not possible today, tomorrow we'll discuss them. Constipation. What he says about the constipation? Constipation always before and during menses. Very, very, very important. It is given in italics by Allen. So constipation before as well as during menses. Diarrhea before or during menses, ammonium carbovista, Bratrum albo. There are many, many remedies. But it is very specifically the constipation in case of the Silicea. And constipation is what type of constipation? That also has been mentioned by Allen. The stools are difficult as from inactivity of the rectum. Stool never comes out completely. With great straining, as if rectum was paralyzed. Stools when partially expelled and recedes back again, like a thuja. Many times the patient tells that they never comes out. I have to put the finger and then I have to remove removal of the stools with mechanical aid. That is what is required in Silicea. And this patient talks. Those who suffers from such types of constipation, they talks directly. They never keeps the shame in their mind because it troubles them a lot. And there are two important remedies. Most important remedy is silica. Second is the thuja. Feces remain a long time in the rectum, and that's why they becomes more hard and hard. So they never comes out very easily. Fistula in ano alternates with chest symptoms. There are two remedies mentioned in the bracket, that is the Berberis vulgaris and Calcarea fos. And this symptom is very characteristic. Either there are chest symptoms, or when chest symptoms are better, the fistula in ano again opens, and it alternates with one another. Sometimes there is fistula in ano, then it seals, then chest complaint starts. And this is very important thing one must know. You should find it out a remedy which covers both the aspects. So you have to consider the fistula ano alternating with the chest complaints a remedy Silicea. If you try to just focus on the fistula, then there is a problem. If you focus only on chest symptoms, there is a problem. Unless and until you focus specifically on the whole symptom that indicates the state of the remedy, either it might be Calcarea fos, either it might be a Berberis vulgaris, either it might be a Silicea. But here, many things are differentiating factors. Silicea is too chilly remedy. Silicea, the stools never comes out, has to remove them mechanically. They comes and recedes back. Then there are hard stools, all those things which you have to take into consideration while considering this. Then he says discharge of blood from the vagina every time the child takes the breast. Very important symptom, unique symptom. Whenever the mother starts feeding the child, there is a discharge of the blood from the vagina. Very important thing. Because this is unique symptom. Here he explains over there that this symptom should be compared with the crotontic. But crotontic doesn't have this symptom. Crotontic has a different aspect. If you open the crotontic, there is one important feature which is mentioned over there, that drawing pain through the chest from breast to scapula of the same type, same side every time the child nurses. In case of crotontic, if she is feeding from left side, there is a chest pain which radiates to the left scapula. If she is feeding from right side, that there is a chest pain and which radiates to the back side. So these are very important things one must understand. These are the differentiating factors, and these are unique factors which you have to take into consideration when you are considering the silica. So every time there is a discharge of blood from the vagina, whenever she takes the child for the breastfeeding. One other feature which is very important, nipple is drawn in like a funnel, and this indicates the malignancy. Malignancy, there is whenever malignancy is there and there is heart tumor is there, and if it is cancerous, it is fixed attached to the lower sub parts, then the nipple gets inverted, retracted inside, and this is there given in Silicea, and it is wonderful remedy to be considered in such type cases. Sarsaparilla is mentioned for the same, but more than sarsaparilla, Silicea plays very vital role in such types of cases. Night walking, somnambulism, that is more important. Somnambulism, night walking, gets up while asleep, walks about and lies down again, and he forgets that this has been done. This is too important. So you must know very specifically that this somnambulism, whenever happens to be there, the children, whenever wakes up in the morning, they never understand this is what happened. They forgets all those things. It has happened during the sleep process, like a Calibrom. Calibrom also has the same feature. So Calibrom also shows the similar type of feature. Then the skin complaints of skin Silicea, and they are most important skin complaints. There is one suggestion to all of you, those who have kept their videos on, please keep your videos off because it disturbs the flow. Dr. Birasin Sahu, my suggestion is for you that if you keep your videos off, that will, because it is continuously moving and disturbing the scene. You keep the audio on, video, you should keep the off so that it will not disturb the flow. Okay. So unhealthy skin. See the skin complaints. Unhealthy skin. Every little injury suppurates. Unhealthy skin. Every little injury suppurates. Like graphitis, like heparsol, like merksol, like petroleum, like calendula, like sulfur. There are many remedies with this feature. Soranum also have the similar feature. But what is the characteristic that we have to understand? There are crippled nails on the fingers and toes like antincrude. The nails are fragile and they are crippled. In antincrude, the fungal infection of the nails, tinea ungualis, anti-crude is most important remedy, and from biochemic, if you use along with that Silicea, it helps a lot. This is a wonderful remedy to be considered. Then takes cold from exposure to feet. So exposure of feet, whenever is there, immediately patient catches a cold. Very common symptom of the Silicea because they are too chilly. So even feet are outside of their covering, and there is a draft of air, immediately they catches the cold, like Conium maculatum, Cuprum metallicum. But in Cuprum, it is more of the cramps which develops in Cuprum. Sweats of the hand. The hands are sweaty, the toes are sweaty, the feet are sweaty, the axilas are sweaty. And what type of sweat? It is very offensive, very, very offensive. It smells like carry-on like. There is one word, intolerable, sour, carry-on like odor of the feet. Carry-on like means as if mm, what you can say, the meat which is getting spoiled, the smell which comes out at that time, the spoiling meat, that is a typical carry-on like odor of the feet without perspiration. So intolerable sour carrion like odor of the feet without perspiration every evening. Evening they don't sweat, but that smell is very typical, and that gives you idea that it is Silicea. Silicea, when comes to your OPD, they remove their shoes outside, but when they enters inside your cabin, you get that stink, and that you think about the Silicea. That is more important. You can catch fistular ecchymosis. That case I have discussed, that dacryocystitis. It is like that fistula lacrimalis. Ingrowing toenails like Magnetis polus australis or Ticurium marum varum. This is one more remedy one should think. Panaritium. Panaritium is nail bed infection, which we have discussed while discussing the allium cepa. We have discussed panaritium. Blood boils, carbuncles, ulcers of all kinds, fistulas, painful, offensive, high spongy edges, proud flesh in them, fissura ani, great pain after stool. See, if you learn the Silicea, you get this fissures, fissulas. These are very common, and fissula anywhere. It is not specific site that every time it might be it should be a rectal fistula. It might be a fistula at lacrimal duct, like fistula lacrimalis. It might be a dental fistula. Anywhere these fistulas are there. And fistula is a tract open at both ends. And fistula is the thing which indicates the syphilitic miasm. So this remedy is very specific for psychosyphilitic miasm. Very important remedy. So all varieties of fistulas are there. Then most important symptoms is desire to be magnetized, which ameliorates like phosphorus. Desire to be magnetized. Many people never understand what exactly it means. These are the peoples. If someone, if they are listening someone and they gets magnetized and they likes to get magnetized. They likes the yes, I like that fellow's talk. Yes, I used to love him, and they likes to get magnetized under it. They get influenced very easily, and they like to get influenced. Phosphorus and Silicea, these are two remedies. Those always likes to get influenced from the others, from the people, from the certain people whom they like most, and then they get under that influence. That is very typical desires to be magnetized. There are people who used to take it in a different manner, but this is the right way of understanding desire to be magnetized. So they like to get influence of someone. So if they are in certain stress, they always want to go somewhere, to go into the to listen some religious thoughts, and they get attracted with that, and then after that they get relaxed. This is desires to be magnetized. That aspect one should not forget. Promotes expulsion of foreign bodies from the tissues, fish bones, needles, bone splinters, etc. And that case also, we have discussed two cases regarding that on the day one. So it is the wonderful remedy to throw away the foreign bodies from your body. If it is troubling, if the body has not adapted it, and body is trying to remove it by its own way, but it is effort, the body's effort is less. The Silicea is the wonderful remedy to be utilized, which stimulates that same process. So if there is splinter in your foot and it is troubling, it is painful and nothing is come out, but every time there is a discharge, give the Silicea, it brings it out. So this Silicea is the very important remedy in such types of cases where you require a stimulus, and that stimulus in low potency always helps. Here you have to give Silicea either in 6x potency, or you can go it with the 6 potency centesimal also. But better I used to use The manner I have told you that I used to think of Hepar first in homeopathy in six potency and followed by the Silicea 6 in repeated doses. And this never fails. It takes out the all those foreign bodies from the body. So these things which we have to understand over there regarding the Silicea, and then he turns toward the relationship. Most important part from the book one has to understand. Complementary, there are two remedies mentioned over here in Allen's keynote. They are Thuja and Sanigula. So very important remedy. And if you see the Thuja and Sanigula, in Thuja is very close to the Silicea at many aspects. Because Thuja covers most of the psychotic aspect, and that psychotic aspect is covered under the Silicea. One aspect is very close to it, and that's why Silicea plays very vital role. And if certain things which are not covered under that can be covered. Mm, Allen has mentioned only two complementaries, Thuja and Sanicula. But if you open the Borix Materia Medica at the end, Gibson Miller's remedy relationship, there are three more are added. First remedy which he mentions is the acid fluor, then second is the calcarea, and third is the pulsatilla. These are three important remedies. Pulsatilla comes as an acute remedy. If your patient is on Silicea and all of a sudden some acute state develops or subacute state develops, pulsatilla is good complementary because Silicea is chronic of pulsatilla. Then yes, we can use this remedy in recurrent abscess. There was a question, yes, we can, definitely, but you have to repeat it for a long time. Then acid fluor, yes, the next step after the Silicea is fluoric acid, calcarea fluor. Where fluor element comes, there are fistulas, fissures. If it has been not settled with the Silicea, then you have to reach towards the fluor. Fluor has that very specific entity. Acid fluor, calcarea fluor, wherever fluor comes, that has that syphilitic aspect over there. Then compare Hepar, the picric acid, the Caliphos, the Hypericum, Ruta, Sanicula. Say, so these are the remedies. There is Gettysburg word is used, but that was a place. It is the name of the place. Remedies are only Hepar, picric acid, Caliphos, Hypericum, Ruta, and Sanicula. And you compare these remedies with the Silicea, then you will find the differentiation very easily. Hepar is too chilly like the Silicea. Both are very close to each other. Hepar is more syphilitic. Silicea is more psychosyphilitic. Picric acid is debilitated person where degeneration is more marked than the Silicea and where loss of strength, the pernicious anemias, then there is a pin mania, all those things which you can get over there, the priapism, which is another feature you can get with the picric acid. Caliphos, the nervous debility, where both remedies close to each other. Hypericum, again the nervous hyperesthesia, which is close to the Silicea. Ruta, specifically in the injuries or rheumatism. Then Silicea also has little bit aspect over there with in the injuries. And Sanicula, already we have discussed this remedy. So these are very important things which one has to compare. My suggestion that open the same remedy from the Allen's keynotes, read it and compare it. If you do it this homework, then you never forget the remedy. It is the follows well after the calcarea, graphitis, hepar, nitric acid, and phosphorus. This is very important thing that you always look towards the relationship. I will share one case. It was just I recollected that in my mind. There was one patient who was brought to me for the recurrent adhesions of after the appendicectomy. That fellow, young fellow, who was just in past the 12th or just first year of engineering, and he was operated in surgical hospital for appendectomy. After appendectomy, within 6 months, he again developed acute abdomen. So on in USG, nothing found. So the laparotomy was performed, and under laparotomy, then they found that there are many adhesions which developed over there of the intestine. So they resected the adhesions and closed it. He was again better for another 3 4 months. Again he started getting same thing. Again he had adhesion. 3 times he was operated, and then they came for homeopathic opinion. Can we prevent this? Because a doctor has said that we cannot do anything. So that fellow was brought to me. I treated him for 1 year consecutively, and Silicea was the most important remedy which I used in that case in 6x potency for longer time of duration. And thereafter, he never had adhesions. It was completely prevented. And now this fellow becomes an engineer, and now he is doing a job. Thereafter, no more recurrence of adhesions happen. So it is a wonderful remedy which has the capacity to dissolve the fibrous tissue, as well as that it maintains the harmony. It's followed well by heparin, fluoric acid, lycopodium, and sepia. These are the remedies with which you can follow after the Silicea. Modalities: aggravation by cold, aggravation during menses, aggravation during new moon, aggravation uncovering, especially the head, and aggravation by lying down. So modalities are very important, very important modalities. New moon as well as full moon, there is aggravation in silica. Moon phases always aggravate the silica. Then lying down aggravation is very important. Then he has mentioned about the uncovering, because patient is too chilly, very easily catches the cold. And that's why silica, they are very sensitive personality. And amelioration, warmth, especially wrapping up head tightly. These people always wraps everything, whole body, never keeps anything open. All the symptoms except gastric, which are ameliorated by cold food. Except gastric symptoms, all symptoms are ameliorated by cold food, like lycopodium. So see, modalities also defines the individuality of the silica, and these are very essential. Silicea is very deep acting remedy. If you see the action of Silicea, it is nearly about 40 to 50 days action have been mentioned. And this is truth. Silicea being a polycrest, very deep acting remedy. It is a wonderful remedy in your day-to-day practice. You can utilize it for many aspects. So Silicea plays very vital role in day-to-day homeopathic practice. Last sentence of Allen, one must keep it in your mind. Silicea is the chronic of pulsatilla. This sentence comes and we never understand what it means. When we treat any subacute inflammation with pulsatilla, because pulsatilla is close resemblance with that case, and after completing that, to prevent the recurrence, you must think of Silicea, because it is the remedy which completes the action of Silicea. It is the remedy which is very defecting. Silicea is pulsatilla is subacute, whereas Silicea is chronic defect, and that's why Silicea covers the whole case and it prevents the recurrence. So whenever it has been mentioned like this, pulsatilla is acute of silicea or aconite is acute of sulfur, then you must think what exactly does it mean. So if silicea is big, one part is pulsatilla. Whenever you think about pulsatilla, rest of the things will be complemented with the help of silicea. And this is what the Allen wants to say about the silicea. So you have learned many aspects about the Silicea. You can learn much more if you open the Sussler's 12 tissue book, and you can understand many things over there. So these are very important things one must think. Then we'll discuss there are 2 3 questions are there. Why varicose veins are more common during pregnancy? Its answer is physiological. Simple, because there is a pressure in the blood vessels, they get increased. Ultimately, there is a big load on in the liver area and abdominal area that presses downwards. and varicosity is the result. It's so simple. It is physiological. Restox restlessness and aconite restlessness. Dr. Rajishi has asked. Yes, restox restlessness is physical. Restox restlessness where patient cannot sit in one place, patient cannot lie down. But in restox restlessness, patient is not having the fear or anguish of the aconite. Aconite has a tremendous anguish, fear, and with which he is tossing in agony and he comes to you. So this is very specific of the aconite. Aconite patient comes to and he is in great mental stress and he is talking, doctor, save me, I will going to die, please. And that type of mental restlessness is more common with the aconite with fear. Restox, it is different. It is more physical. Restox become restless because in one place he gets aggravated. So this is very important thing one must understand. Can lipoma can dissolve, can be dissolved, can be because unless and until it is similimum, it never. You have, it is not a fixed remedy for lipoma. Sir, how to differentiate anticipatory anxiety or stage fear of the Silicea and argentum nitricum? Argentum nitricum. Argentum nitricum is always in a hurry. Restlessness is there with argentum nitricum. Silicea has complete fear of going on stage. Argentum nitricum, it is very specifically related with the time, anxiety when time is set. So argentum nitricum happens to be there. If I want to go to tomorrow morning at 5 o'clock to the Pune, I want to start. Then whole night I used to get again and again disturbed sleep. I used to see her, it's 1 o'clock. Then again I sleep, again checks, it's 2 o'clock. This type of anxiety which develops over there in argentum nitricum, and that's why it is very classical that anxiety when time is set, which is present with the argentum nitricum. Whereas Silicea Silicea is most cowardice and they get exhausted. They never wants to talk, never wants to discuss, never wants to lose their energy, and they feels what I will going to do on stage, and that's why they fears and they never goes on stage. So Lycopodium is there. Lycopodium who fears, but he goes on stage and performs. He's a very good performer later on. But Silicea, not at all. There is complete loss of great confidence in Silicea. So this is the difference between these.
Sir, what about thyroid?
Hello?
Sir, what about thyroid? What is the biochemic?
I could not understand.
Thyroid problems.
I'm not getting your voice clearly. You write it down, that will be better. If you write, then it's quite easy for everyone to read and easily I can discuss the things. No, thyroid, what is your question regarding thyroid? Whether is there any role of Silicea in thyroid? If it is constitutional, definitely. It is not specific for thyroid. It depends if it is calling for specifically for the similimum or constitutional of the patient is Silicea, you can. Not specifically. Potency in abscess depends for what purpose you have to use. If you have to open the abscess, low potency. If you want to stop that abscess, if it has not ripened completely, then high potency. Fistula, the same thing. Fistula generally it requires low because you have to open the abscess. We don't have to keep it inside. So fistulas you have to start with low. Okay. So that's all for today. Tomorrow we'll continue with the session and we'll start with one more new remedy from our second year syllabus. So it will be beneficial for everyone and even from practice point of view. So thank you being there. Good night. Yes, Shahrukh, thank you being a member of our school, the Divine School of Homoeopathy. So ask your friends to join our activities, ask them to join this Materia Medica session. and ask them to subscribe our channel. Those who have not yet subscribed, subscribe the channel so that you can get all intimations over there. Okay. Thank you very much. We'll meet tomorrow. Thanks a lot.